Thank you all for joining us today. This is the Health-Related Social Needs Partner Work Session that we've scheduled for October 10th as part of Oregon's 1115 Medicaid waiver implementation. We have a fairly straightforward agenda today. We're going to do what we always do, which is set some baseline knowledge around our 1115 waiver and the things that are changing with Oregon Health Plan. And then we're going to follow up on something that we started at the end of September, which is to take a close look at the Health-Related Social Needs Services Eligibility Form and conduct a review all together and get your feedback, your thoughts, your comments, your questions and concerns about this form and use it as one of the tools that we're both making the form better and also have this opportunity to use it to help us all get a shared understanding of what it's going to look like once health-related social needs service delivery starts. So that's our goal for today. We plan to have plenty of time for additional Q&A and next steps, including talking a little bit more about what the next few sessions are going to look like. Here's the part where I repeat information that some of you may know, but on the off chance that some of you don't, I want to make sure we all have what we need to participate. So I'm going to talk not too long about what we mean when we say the 1115 Medicaid waiver. First off, what is a waiver? Before we talk about waivers, we have to talk about how we do Medicaid here in the United States and how we do Medicaid or Oregon Health Plan here in Oregon. So Medicaid is a partnership between states and the federal government. We have a set of rules that we use to make sure that people are getting Medicaid in a standard way, and we're meeting the requirements of the programs, and we are making good use of federal funds, state funds. We can ask permission as a state to change some aspects of our Medicaid rules. And I would say that's for two major reasons. One is to test and try new things, find better ways of doing Medicaid that we can share amongst the states and with the federal government. And also so that we can make sure that Oregon Health Plan is built in a way that meets Oregon needs. So there is this opportunity to try new things and to see what sticks, to see what we can make into our business as usual. So right now, when we're in the waiver phase, it's every 5 years we try something new with the hopes that it is successful and we can make it our business as usual plan and find ways of doing that and learning from one another. When we talk specifically about waivers here in Oregon, we've been on an 1115 Medicaid waiver since 1994. And we use it to make sure that the Oregon Health Plan is more flexible, covers services maybe we weren't able to in the past, and increase the number of people that we can cover. I mentioned that this is a 5-year process. This current renewal was approved starting October 1 of last year, 2022, and it goes through September of 2027. This is not going to be an exhaustive review of everything that we're doing with the waiver. Know that we are still in negotiation and conversation with the federal government on some aspects of this round of the waiver, and we're going to have more conversations for the next round. So this is not a process that has a clear end and then we are done. It's a continuous improvement. I can't talk about the waiver without really making sure we have a shared understanding of why we are doing this waiver. And it really does, it really all comes down to this first point on this slide, which is we are here to address and advance health equity. The other points below are a little more about how we hope to do that. We want to make sure our healthcare system is equitable, culturally and linguistically responsive. We want to build mechanisms that people can maintain their health coverage, as well as improve health outcomes by going beyond the medical model of health and really looking at those health-related social needs. And as we do all of that, we need to make sure that we're also ensuring smart and flexible spending as well. Calling out that as part of our goal to address and advance health equity, we are committed to making sure that Healthier Oregon OHP members or any folks who have OHP benefits as part of innovative state programs, they also are included in waiver benefits. So you will see anytime we talk about OHP members, please know that that's inclusive of Healthier Oregon members or anyone who's on OHP who does maybe not have a traditionally qualifying immigration status. Now, here in this series of work sessions, we have focused on, and we'll probably continue to focus on for the time being, the health-related social needs supports and services that we are able to start offering to folks as part of the waiver. And that includes housing, nutrition, and climate supports. But it's also really important to understand that there are other aspects of the waiver that are happening as well. Things to extend OHP eligibility for young children, youth, and adults. And one of the aspects of the waiver that is live right now is continuous eligibility. And so that's for children up to age 6, once you get on the Oregon Health Plan, you more or less can stay on the Oregon Health Plan up to the age of 6. And for people 6 or older, that translates to 2 years of continuous eligibility instead of the 1 year, and it has additional protections for folks. Something we're not going to talk at length about today, but is also an exciting part of the waiver, is additional coverage for young adults with special health care needs up to age of 26. And I'm about to round out the level setting and baseline setting for this session by talking a little bit more about the health-related social needs as a concept and then what that means when it comes to the waiver. So when we talk about health-related social needs, and because we love our acronyms, you will see HRSN start to pop up on these slides and in other documents. These are the things that impact someone's ability to maintain their health and well-being that go beyond medical care. So for example, in order to be able to go to a doctor's office and make an appointment, you need to have access to stable housing. You need to have food. You need to have a way to get to that office or technology to talk to a doctor. There's all sorts of things that are required for people to be able to access our healthcare system that live outside of the healthcare system. And so when it comes to the waiver, this has been put into 4 broad categories: housing support, nutrition, climate-related needs, and then a 4th category called outreach and engagement, which kind of encapsulates connecting people to those first 3. And now I've set the stage for us. Please feel free to put in the chat any comments or questions, or if there's anything that we can do to better explain that baseline information that I give pretty regularly. But we did want to switch gears, and today's a little different from our other sessions so far. I'd like to think that means it's a little less of me or a subject matter expert lecturing you and more of us listening, which is that we shared a service and eligibility need form last session. And after a few more level setting slides, I'm going to open up that form and we're going to walk through it, and we want to hear from you all. So let's talk about the service and eligibility need form. This is a form that we have started drafting that has some required information, and that is that we need to get enough information to make sure we understand that people have a need for the services that we're offering, and to give us enough information to start to connect those dots. So We need to make sure that people are a member of an eligible population for those health-related social needs. We need to make sure that they meet the social need, at least one piece of social need, which is things like, do they need climate supports? Do they need housing supports? Are they the supports that we are able to offer? And there is also a clinical piece to this puzzle as well. Another piece of this is really making sure we have a place to record the service recommendation, how long people will need this service and what its specific pieces are. And you see there's an example here of it could be someone needs medically tailored meals and education on nutrition, and that's the specific recommendation that goes forward through this form. A couple caveats. In order to be eligible for these health-related social needs services through the waiver, they can't already be receiving the exact same service through state, local, or federally funded programs. So we're not allowed to replace existing supports. Also, there may be, depending on what type of service it is, there may be additional eligibility criteria. So some people may be eligible for some parts of the HRSN world, and that's going to depend on some of those different eligibility factors that we also need to collect in this form. And I also want to pause for a moment and say there are some subject matter experts here in the room. So if there's any point where I'm going off script or you have more nuance than what I'm saying, please don't hesitate to interrupt me. Another piece of this is, so there's the information we need in order to provide services to people, but there's also minimum information that we need in order to start the process. So something that is a referral to a coordinated care organization or to Open Card OHP is we need a member attestation that they want these services and they know this referral is being made. We need a way to contact them, and we need a description of that service need. And so we are looking to get what information folks have, and then there may be times where there is additional information that we can collect, that the CCO can collect, for example, after this referral has been started, as opposed to forcing everyone to fully fill out this form in all of its detail before we can start to get moving on helping connect someone to services.
Excuse me, there was someone in the waiting room. Can you just double check that there isn't anymore?
I was just letting 2 more folks in.
Okay, thanks.
Jessica, sorry to interrupt. Could you make me a co-host again?
Oh yeah.
Thank you.
And thanks for your patience, everyone. It's I don't know, the computers have not been super happy with me today. Actually, while I'm paused, I'm wondering if there are any other questions or comments or any other feedback folks have right off the bat before I start sharing the form itself. And
Jessica,
yeah.
There is a question in the chat.
And the question is leveraging supported with other agencies to provide that need? And we have some subject matter experts on the call, so I'm going to pause. And see, for example, Meg, do you have any details on?
Yeah, and I'm wondering, Kim, if you wouldn't mind repeating the question so I make sure that I answer it really specifically to what you're asking. Like, what will the waiver do to coordinate with other agencies to braid these necessary services? Is that kind of what you're getting at?
So we're a service integration team in the Canyon. And so what I do is I try to find leveraging, right, with other agencies, not just pay for a need. So I'm wondering I know right now, sometimes with Pacific Source, we get that they don't want to leverage because they need to be a funder of last resort. Is this something where we could use, you know, this avenue to leverage with money that we might have or our partners might have?
I love that question. And I think that the answer is that is exactly what we would like to see. And the reason that I say I think is because this is where the detailed operations really need to be worked out. And I'm not sure that I know all of the implications of everything that you're talking about and what are some of the the implications that would get us stuck either around regulation or otherwise. But to the reason that I said I think this is exactly what we would like to see is that our negotiation, as Jessica was talking about in this waiver, is that if we can use Medicaid to help start to bridge some of these fundamental sources of health, well-being, and healing, housing, nutrition, you know, devices so you can stay in your home during climate disasters, then we can use Medicaid as one of the sources of stabilizing while we're bringing on other sources that are either Medicaid benefit or non-Medicaid benefits, such as grant funding, such as other community-based programs, such as funding by other federal agencies or other state agencies, and that this really is meant to be a temporary access to funding to help stabilize, get people into services to better assess what they need and to better find that long-term funding supports. We also know that the HRSN services don't, for example, cover all of the housing related needs or all of the nutrition services, as well as some of our other programs cover some of these, but not all. And so we really anticipate it will be a bit of a quilt, if you will, of what HRSN can pay for, and let's leverage the Medicaid funding and the federal match we have in that funding to have Medicaid pay for as much as it can, but knowing that other programs will also be able to put in pieces to that quilt to more better approach truly holistic and person-centered care. Does that, I mean, I appreciate that's a little bit of a non-specific answer, but maybe gives you a sense of the vision that we see, where we see this fitting in.
It's very optimistic, so I will leave it at that.
It's incredibly optimistic, and thank you for raising that, frankly, because that was my other reaction, is that building this is what's going to happen over the course of the demonstration. That we know that this is not going to work out perfectly right away, but why we are so grateful for you all being involved now and for continued engagement so that we can refine how do we leverage resources, frankly, more efficiently.
Thank you both. And I think I do also want to call out that as we continue to hold these work sessions and look at different aspects of the work, I think it is going to lead us to questions that we don't have answers to and questions that can absolutely inform what we bring back to you all. And so whether we have a satisfactory answer or not to a question you're asking today, it is so valuable to hear from you all. And there are a few more questions and comments, and so I will keep reading them out loud. The next one is, would there be a way to utilize existing platforms such as Unite Us to submit these referrals to the CCO? And I know an intellectual answer that absolutely that is a direction we want to be going, but I don't know if any folks who are currently on the line have more detail than that. And that's using community information exchanges to really help facilitate the right information getting to the right folks.
We know that there has been obviously investment in community information exchanges such as Unite Us, and are absolutely anticipating there will be a role for those, particularly to meet one of our Centers for Medicaid and Medicare CMS requirements about establishing a closed loop referral. We are not requiring a platform like Unite Us in the first year, and we know that there are many reasons why some CBOs prefer not to use a system like that. And so yes, there will be a way to utilize existing platforms, and there will also be some alternatives, particularly in the first years.
Thank you so much, Meg. I see a comment and a question next. Oftentimes, individuals who may need these services, especially those experiencing houselessness, do not have access to a phone or email account. How does this form plan to accommodate for that?
Thank you for raising this real challenge in the design. We know that for many individuals, timeliness is absolutely crucial, and that somebody may meet with a community partner, a community agency one day, and it's not clear to anybody if they'll be able to come back the next day, for example, to follow up on services. And so that has been something that is very much in our design, and we look forward to y'all telling us how we really need to make this happen so it works for every single Oregonian, regardless of where they're living, regardless of everything else that's going on in their lives and their ability to engage with services on their schedule and in a way that's relevant. The idea of this form is that it is the start of a mechanism to collect information. Also, as Jessica said in the beginning, this form provides the information that's needed to be able to refer and authorize these services. So it may be that these questions are asked in existing forms that agencies have and are using, and we just need to pull that information out from the existing forms in order to get it to the coordinated care organizations or for fee-for-service members, to our third-party administrator to compile that information and either fill in any missing information needed to make the authorization, or to compile it and make the authorization. For individuals who don't have a phone, don't have an address, are living in various places, are unhoused, this is going to be tricky, and I think this is the role for the outreach and engagement benefit, which is one of the other services that this Medicaid benefit provides, because we anticipate that for some people it will be repeated outreaches, repeated conversations in community to get the information and to connect with services. This form, there obviously, as Jessica just described, the member needs to attest to this form, or the member's guardian needs to attest to this, to the information on the form, but the member themselves does not need to fill out this form and present it to an agency. We see this as having many paths in. Maybe the member fills it out, maybe a community-based organization, a peer support specialist, a traditional health worker helps the member fill out the form.
Thank you so much, Meg. And also a good teaser for some content we plan to bring you all in the near future around those outreach and engagement services. And I will also tease, I see a question in the chat that is specific to funding the startup of these services and making them sustainable. And that is absolutely a conversation we want to continue with you all as well in the next few weeks. So I'm excited to see that the things that we're queuing up for our next few sessions are things that are naturally coming up. That's a good sign. And then I also see an excellent question that really points to me needing to update the baseline slides that I'm using, because this is very important and should be really foundational to what we're sharing. And my apologies. The question is, if people are not yet on OHP, is the first step to get them onto Medicaid? And the answer absolutely is yes. And I think a slide that directs that first foremost, front and center, absolutely. So for the health-related social needs, this is something we are building into our Medicaid and Oregon health plan system. And so we need to know who these folks are, and we need to know that they're eligible for the Oregon health plan first. And then after that has happened, that's when this form and this content would become important, looking at not only all the other things that people get when they're on the Oregon health plan, comprehensive health care that includes physical, behavioral, dental, we want to make sure that in addition to all of the things that are already on our traditional Medicaid, we then are also looking at service eligibility for these health-related social needs as well. And so I think you've pointed out a gap in my slide deck, and I really appreciate that. Oh, and I see a hand up. Oh, Yoni.
Hey, Jessica, this is Yoni. So I'm really happy someone brought up kind of the enrollment issue. One of the things that we see at our agency is when we screen for healthcare coverage, folks might be giving us outdated information on who their CCO or fee-for-service is, and we don't always have a way to verify, not only like everyone we serve is OHP eligible, but we don't have a way to verify, are they enrolled in OHP? If so, who do we contact as their CCO contact, right? So it's kind of like 2 layers of both OHP enrollment as well as what CCO they're assigned to. And that's for coordinating both for the purposes of the HRSN waiver, as well as just generally identifying like behavioral health and acuity issues. So that's all I had to say.
And that's a great point. And it's honestly something that has been a constant struggle, is to get updated and accurate information about folks' OHP, their CCO information. I do know that I can't help but point folks towards a team that I was on for many years, which is the Community Partner Outreach Program here at OHA, has a network of community partners who are certified to help people navigate that, both the getting, keeping, using their OHP. And I know that that network is currently working to expand the tools that their certified application assisters have to verify information about someone's OHP. So I think now is a great time to look into that and see how that can also potentially apply for work such as this health-related social needs work. So first off, just had to say that because it's what I know, and I feel very strongly that that's an excellent network, and I'd love to point people towards it, and also to encourage people who maybe, if they're not yet certified to do that work, that could be a really valuable thing to do. And it's also making me realize that our next session, which I was going to say this for the end, but I keep alluding to it, so I'm just going to say it out loud, which is digging more into the outreach and engagement supports and services that are built into the waiver, could also start to help us piece together these other parts that live outside of the form that we're going to look at today. Whew, I talked a lot. I'm going to pause and see if anyone else has something they'd like to add. And also, Yoni, don't hesitate to let me know if I did not answer your question. And I think also it's an excellent question for us to log to make sure that we're building into these systems too.
No, I think you gave a great answer, Jessica. I think the need for, if we're talking about integration of social services and healthcare, there's really a need for both bilateral referral and bilateral communication. I think that starts with identifying OHP enrollment, but will quickly turn into the folks that we house through the HRSN housing benefit, their underlying healthcare needs, whether that's behavioral health, substance use disorder, physical health, they don't go away just because they're enrolled in the benefit and housed. So how do we make sure that the caseworkers who are working with the client on the social service side is in a position to identify issues that impact health outcomes for HRSN beneficiaries in a meaningful and collaborative way?
What a great point. Thank you. Oh, Ashley, I see your hand is up as well.
Yes, thank you, Jessica. I am just really loving all these questions that are coming in, and I really invite everyone to bring your questions and comments and concerns to us. Like, keep them coming. Keep asking the difficult questions. If you have other, things that you want to talk about offline, feel free to email the waiver email. But we're really trying to be intentional with setting this up and be collaborative. So please bring your ideas, and so that we can elevate those. Thank you.
Thanks so much, Ashley. Yoni, I am realizing I'm not sure if you still have your hand up or if this is a hand left over from the last.
Hand left over. Thank you.
Okay. Thank you all so much. I think we're probably ready to transition into looking at the form, but please don't hesitate to put your hand up or to put something in the chat, knowing that there might be some things that I triage to a future session, as I have been pointing us towards a few times today already. So one moment and I will get our Word document up. And this should be exactly the same document that you all received in advance of this session. And I think just because this is a Word document, we do have some folks on the back end who are hard at work taking notes and collecting everything that you all say. I'm probably not going to put live edits into this because we have smart people who are doing that on the back end. And maybe we start by taking this one paragraph at a time as we get down through this. And I will say a little bit around the piece that we're looking at, and then I will pause and see if people have questions, comments, edits, anything like that that they'd want to bring to us. First off, we have the HRSN eligibility and service need form. The red text is just so that we know which version of this document we're looking at and that we're keeping version control for ourselves and for you all. And I'm going to point us towards the purpose. Oh, actually, I'm going to pause and see if Meg has something.
Oh, yes, thank you. I do. And just because we have gotten this question internally and our team has talked about this at length internally, who is the audience for this form? So as Jessica is going through it, I wanted to be really clear that we know the audience for this form is individuals who want to self-refer, and to community-based organizations, community partners, you all who are helping individuals connect to and helping to make the referral to the services. So we welcome everything from high-level edits to wordsmithing. We know the very specific words we use are incredibly important. And so please, the whole breadth of comments we welcome at this point. And Jessica, there are about 5 questions that our team internally for sure really are struggling with and wanted some thoughts on. And so I may help us highlight those, but as Jessica said, welcome all comments to all parts of this form.
Thank you so much, Megan. Please feel free to interrupt me at any point in time. I want to make sure this is valuable to everyone. As we look at the purpose, and I think also thinking through, sorry, interrupting myself now, to speak to what Meg was just saying, I really invite you all to not see this as the be all end all of, this is a very specific government form that must be filled out in a specific way, but this is a framework for what information we need to know. And I'd love for us to collaborate on if there are better ways to get to the information we need to know. With that said, I will switch gears and focus on what is physically written on this document, which is the purpose is please answer the following questions about the needs of the individual that is being referred for health-related social needs services. An individual is also permitted to fill out this form on their own behalf. Health plans will use this information to determine eligibility to receive services through the HRSN benefit program, such as housing, nutrition, or climate supports. I'm seeing good, broad questions and comments. Misha, go ahead.
Yeah, I'm not typing very fast today, so I was just going to speak out. I think for a purpose statement, it's not really, you don't start asking, please answer the following. It's just to say very simply, this form is and can be filled out by an individual on their own behalf or will. I mean, it's just, it's a really quick sentence. This is an eligibility form.
Mhm.
It's not a please answer. Does that make sense? I mean, even grammatically, when you're saying it's a purpose statement, it's just this form is to. And then under instructions, it can be an individual can fill this form out, an individual can have someone else help you fill it out, an organization, or even within instructions or as a recommendation, you can say it can be helpful to have assistance with this form. Anyway, yeah.
Yeah.
And I anything to keep it every section shorter, simpler, and not repeating too much, just to reduce confusion.
Absolutely. Thank you. And so what I'm hearing is for the purpose, we want a really concise statement of what this form does. And then there are aspects that are currently in purpose that are truly instructions on filling out the form, and that we could probably break that down a little to make it clearer.
Yeah, that sounds right. And bulleted points, I think, help too, instructions. So it doesn't look like just a lot of narrative text. And then just font size, all these things to just make the form just look less intimidating.
Mhm.
Things like that. I could even discuss at some point how having some graphics to help illustrate some of the instructions might be viable in there, filling it out on your own, sitting down and filling it out with someone else. I don't know how far you'd want to go with that, but I work with a lot of people who have highly variable levels of literacy, and graphics are always on my mind.
Absolutely. Thank you. And Kelly, I see your hand is up as well.
Yes, it is. Thank you so much. To start with, I would make sure you typed out what HRSN means at the very beginning, because if this is a new form for folks, they're not going to have that context. I agree with Misha about bullets. I love them. I would say an individual is also permitted to fill out this form for themselves instead of on their own behalf. If you run this through the reading eligibility criteria, you may find that it's above 8th grade literacy level. I just would recommend doing that. And then it's also confusing to me in the instructions. Please complete as much information requested below as possible for the individual or the individual's guardian that you're working with. So that would be instructions if I was helping, because I'm a provider. And then it says you may work with a supporting organization to complete the information below as needed. And I assume that's if the individual is filling it out for themselves. I don't know if that's accurate. And then my last question is, I absolutely hate being on the phone, and I wonder, is it possible to check the member's health plan on it through a website, or do they have to call that 800 number?
These are all great, and I'm almost wondering, based on what I'm hearing just immediately, if a section may be bulleted under instructions, or like who can complete this form, and to start to tease out some messaging depending on who is accessing. You all can
Sure.
I like that. I like that a lot. The who, what, all that. Just keep it, really simple like that. I like that, Jessica.
You can also have two separate, which I realize is administratively difficult for OHA, but two separate formats, one for an agency that's providing support to someone to fill out the form, and one for self-referral.
Thank you. And I'm looking at the information on confirming someone's health plan, and I think that actually goes right back to that conversation that Yoni and I were just having around, depending on who someone is, the tools that they have access to might be different, and that might require its own separate guide, I am realizing. I think that when in doubt, this 1-800 number absolutely will get to eligibility workers on the other side who can confirm in our systems, but there are other opportunities for different folks depending on their role. And I'm realizing there's a lot of great stuff in the chat, and I have not been keeping up while I've been talking. I do want to say I have a few questions in here that I don't think we're going to get to today, but are valuable around turnaround time for this form, and other details about what happens after this form gets submitted. I don't think we'll have time to go in depth on that today, but I think they're good for us to keep in mind as we continue this conversation. And I'm not sure we have answers right now on languages, but I do know that is, actually, Meg, I know we've talked about this. I don't know if there's anything you can share on translation and language accessibility.
Yes, I just thank you all for all of these questions. These are fabulous. They validate some of what we've been wondering about, and they add new thoughts that admittedly we haven't thought. Yes, absolutely. This form will be translated or co-created ideally, and so our goal is to have this form. We haven't landed on exactly the number of languages, and but part of our talking about this with you now in early October is it so that it can be in multiple languages by the time the first climate-related benefit starts on January 1st. One of the things that is not clear in this initial section is that not all of the information is required to be filled out. So I appreciate some of the comments in the chat about some of this is really private information. How would we know this? And the goal that we obviously need to put better language around is that an individual or a community agency, community organization fills out the information that they already have or that is readily accessible to them in the context of their relationship. We agree that it would be inappropriate for an agency that talks to an individual around certain services all of a sudden ask a whole bunch of health-related questions or other personal questions that aren't really relevant to the scope of work of that agency. And that is where the combination of what an individual and an agency can fill out or an organization can fill out, and then what the CCO or fee-for-service team will finish filling out. There was another question about, so what if I find out information that say I didn't know about this individual, this client, this person that I work with? Will I have resources for what to do about that information? And the goal is both yes, and the goal and those resources to a large degree may be connecting that individual with the care coordination team on that individual's CCO or fee-for-service team, because it is the responsibility then of the CCO and the fee-for-service team, given that this is a Medicaid benefit, to ensure that they know the individual's health needs and are connecting that individual with services. However, because this is a Medicaid benefit that's really trying to link the healthcare system with other social services, part of the outreach and engagement benefit is a mechanism for connecting to non-Medicaid and non-healthcare services, other social supports, be it food assistance programs, SNAP, TANF, or other services that the state, the feds, or community can fund.
Thank you so much, Meg. And goodness, at this point, there's so much good overarching information in the chat, and I'm realizing people are starting to tackle some specific questions. So I'm getting the feeling I should start scrolling down.
And just I'm wondering if we could just ask, Brittany asked, maybe 5 minutes ago, what is the purpose of asking the yes or no question in the eligibility for accessing HRSN services? I'm wondering if we can, do you want to save that until we get further down? Or do you want to address that now?
Do y'all mind if we go in
Sure.
order? Only because I worry if I bounce around too much, I might really miss some important stuff. But I do see, let's see. We have a space for a CCO or an open card third-party contractor to insert specific submissions. And then we have a member information section first that says both required and write NA if not applicable. And I actually have immediate thoughts about that myself, because if something is not applicable, then it worries me that it's also required. But I'm not here to tell you my opinion. I'm here to listen to you.
Well, that also confused me, Jessica. That's why I asked the question about, are they have to already be on Medicaid? Because, yeah.
Mm-hmm. That's a great point. This form doesn't actually say that, I don't think. Seems like a good part of the instructions.
Would it be helpful to have it as the first question?
Thank you. I'm trying not to say like, yes, we will definitely do that because I'm not the person who does this and I'm not sure what we'll finally land on, but I think that's a great recommendation. I do think, sorry, here I am inserting myself into this. More clarity on what is truly required to move forward. And if it's something like a Medicaid ID, I think some information about how to access that information if someone is not sure if it is truly required, which I think it may be. Let's see if people have any additional thoughts on member information specifically.
I don't know if there would be possible to have a line for other contacts, if they have a contact through another organization, or if they don't have their own phone or their own email or etc. But I work with people who use either another organization as a contact, or a friend who does have a phone, or a friend who does monitor email. So I just making it more apparent that if they don't have their own phone or email or address, that they could use someone else's that supports them. Does that make sense?
It does. You just made me think about the fact that people aren't required to have an address when they sign up for OHP as well. So they may not have, they're required to have a mailing address, but not a physical address. So it may also be useful to ask for county or other broader information about where people spend most of their time. And then I do see in general, let me know if I'm paraphrasing this right, is I see the minimum information is what should be requested with this form. And it also seems then part of this is putting what is truly required to start that referral first, and then additional helpful information after, so that people can get to what truly needs to happen for us to start this process, and it to be clear which is which. I'm trying to read between the lines on the really great stuff you're putting in here, and trying to keep with just this section. And sorry, I don't know if I'm doing a good job, but I'll try my best.
You got it, Jessica. I think that's exactly right. And highlighting that section in a color or an outline or something and labeling it, that would be awesome.
Mhm.
You're a good reader between the lines.
Thank you. I try my best. But also, folks, don't be shy in holding me accountable. I am seeing that there is a place for the submitting organization information and member information. But those pieces you were just talking about like how people can be reached and how it's best to reach them, there might be a place to put this in this part of the form so that folks don't start with ways of like trying to email someone who has very limited access to their own email or things like that. Oh, yeah, and in fact, Cass said it better than I did. All information that could exclude or expedite a person's claim would be nice to have at the top. That's another related thing that I think is great to call out. I see a lot of questions that relate to further down, so I'm going to keep going. Jasmine, go ahead.
Hey, Jessica, it's Jasmine from Oregon Food Bank. I just had a quick question. I put it in the chat, but I think it got buried. I was just thinking about if it would be possible for folks who want to provide their preferred pronouns on the form. I think that might be a way to like help create like a more inclusive and supportive environment for folks that might be engaging with different providers. So just throwing that out there too.
Oh, thank you so much. I did miss that. I was right there where you also recommended a checklist for people, which I should have said out loud as well. Thank you.
No worries, thanks.
And now the next section of this form focuses in on members giving consent to be referred to the health-related social needs services, to be contacted.
And I will add two things to this section for your all's consideration. The first is that we anticipate that at least some of the eligibility criteria individuals will self-attest to. So not only is this an attestation to be interested in HRSN services, to be willing to be contacted, to be referred, but will also include attestation to the correctness or the need represented on this form. The second consideration that I would love your thoughts and feedback, and I appreciate y'all bringing in the individuals that you work with in your programs, is there are individuals for whom their medical condition and particularly their mental health condition may make it hard to fill out this form. And so how do we ensure, as it was stated up above, that guardians can fill out this form in a way that makes sense and that we are still ensuring that the individual's voice and desires are centered?
Thank you so much, Meg. I'm wondering if people have thoughts on responding directly to Meg and/or the consent portion. Misha, go ahead.
I'm just really grateful that Meg brought that up. I think it's so important, and a lot of times it's a completely missed or ignored point with a lot of the people I work with, to have their voice, their choices, their interests represented. And I don't know the best way, honestly. I'm not here with a good answer. I do think we should try for that, even if it's just a statement for the person filling out the form, that they that they have done that, and at least a reminder that that is their job if they're supporting someone in filling out this form, is to best represent that person and their their interests, not only their interests, but their desires, their yeah. And I Shaquila, I don't know, that's a really good initial yeah, I don't know, it's something I struggle a lot with the group I work with. I'm glad you asked the question, Meg. I want to do better at that somehow in the world of this work.
Thank you so much, Misha. And I also, this is where I am belatedly getting back to some of the things that are in the chat that I probably should have said right away. I saw some requests and thoughts around scripts, or I think the idea of what needs to be on the form versus are there, like, if we put everything into the form that someone might want to say or think about, it might become a very long form. So at what point do we need additional supports and guidance documents or tools for folks to use? And that might apply both to people who are professionally helping clients as well as for guardians and family members or other folks who are trying to help someone connect these dots. There's me once again trying to read between the lines and synthesize what I'm seeing, and you can let me know if I'm off base. And I do see a point to maybe when it comes to some of these consent and having a representative or guardian, there might be some things we can learn from existing forms that exist, such as the SSA authorization of representative form. I guess I would also add in the OHP application assistance form might be useful as well. And I have noticed that usually a consent form is in the first or second person, so it's speaking directly to the person giving consent instead of in third person. And I see a call to keep it as simple and short as possible, and if there are needs for additional guideline scripts or other instructions. Not that the OHP application is simple and straightforward, but I do know that there are a lot of additional tools that have been made that live outside of the application to help people understand it. I'm just slowly scrolling as I go too. Erlette, I see a hand.
Yeah, thanks. This is Erlette Upshaw from Coos Elderly Services. And, we, with our applications that we have to submit to Social Security as well, there are individuals that are not mentally able to make decisions. They're not able to speak. They're not understanding what's going on. So, we provide representative payee service plus guardianship plus conservatorship and power of attorney. So, we act on their behalf, but, they can't give us authorization because they're unable to. So, that might be something to think about. With the Social Security authorization, a representative form, that's the SSA 787, that has to be completed by a physician. And that physician actually is letting Social Security know that they are unable to make their own decisions or they have a disability of that type. So with this form, if we are trying to figure out a way that they are going to give authorization, the individual, I don't think 100% of our clients are going to be able to do that. So something to, maybe think about. And I know we've been talking about that here.
Thank you so much. And that is a really great point. I'm also realizing that I'm not sure we have defined what it means to be a guardian or to have something like power of attorney, and if that applies here. And I don't know, Meg, if you have any more context to that.
Again, I can't tell you how powerful it is for us in this state to have community give voice to the things we know we need to advocate for. So thank you so much for saying that. And I will just acknowledge that this is what I spent my last weekend thinking about. There are individuals who can't consent. There's also the population who is covered for this benefit are individuals who are in transition or are in highly stressful times in their lives. They're unhoused. They're at risk of losing their housing. They're transitioning out of carceral settings. They're transitioning out of congregate care settings, behavioral health residents, right? All of these almost all of the populations are undergoing significant life stresses across multiple domains in their lives. And many won't have a guardian or have set up a guardian to consent for these services. And I think it goes back to the comment, Misha, that you were also articulating is how can we allow individuals who aren't the individual help fill out this form so that these individuals can get the services that they are entitled to as Medicaid enrollees, while also ensuring while also guarding against paternalism and ensuring that a well-meaning other doesn't speak for or prioritize that individual's needs. And I think that that's the tension that we're going to have to solve for, and really look forward to any examples from you all where this works really well. We'll obviously be talking internally and have ideas on other programs about how we manage this, because this is certainly not the only benefit program where that is a tension. So as Jessica said, don't have a great answer. Really appreciate you raising these. Keep continuing to raise them, and agree that we have to sort this out by January 1st.
And I see, wouldn't we want to remove as many barriers as possible? And I think yes. Have a comment about power of attorney that I do not know enough about power of attorney to speak intelligently about, but if there perhaps is some clarity we can give for this form versus some of these other stickier situations.
And to be really, really clear, just to say this incredibly clearly, we know that access to these services we know that timely access to these services is essential. And so having to have an individual go through the process of having to get a formal guardian or a power of attorney and all of the administrative requirements for that will render HRSN significantly less useful, if not useless. And so our goal will be to not require a high bar for assent for a connection to these services. But we'll obviously need to make sure that we're doing so in a way that protects the individual's rights, voice, and choice.
Thank you, Meg. And oh, Cass, I see your hand is up.
Yeah, I think what I meant by, I was thinking that power of attorney is asking way too much for this. I think like possibly creating a form that would allow like specifically for someone to act as an authorized representative of that person strictly for HRSN purposes, not necessarily for anything else. They could help that person make decisions on, do they want to apply for these benefits or a different benefit? And that's it, not something that gives them any type of authority in any other way other than for, the health related social needs.
Oh, thank you. Thanks for that clarity. Misha, I see your hand.
What Cass was discussing there made me think that it's much like supported decision making, and that, you know, I've someone is agreeing to work with someone else, or, you know, as a lead supported decision maker, and that's really the model that we're trying to educate people about. And so this could, I'm just thinking that that's sort of how we're trying to get at one sort of avenue of a solution of something less than a conservatorship or a guardianship, and really helping someone feel empowered. You know, who I this person or this organization is working with me in a supported decision. I don't know. I'm rambling now, but Casta's comments made me think of that.
Thank you. I think maybe just broadly when we're thinking about what it means to give informed consent, and what are the risks and what are the opportunities here, because I think one of the risks I don't really see outlined here, but I do know from my days over working on eligibility, is that one of the things here is people are giving, whether it's the CCO or the person helping them today, some pretty personal information about themselves. And that seems like something maybe people need to be aware of when they're consenting, is understanding who's going to get what information based on these activities in this form. Oh, Carissa, I see your hand.
Yeah, hi, and forgive me because I was late, but to me, from what I've heard in the brief time that I've been in this, I mean, I'm just thinking, like, again, not to create barriers. So, like, you know, thinking really about the goal. What do we want? Sometimes less is more. And, you know, we might be trying to protect people, but sometimes it can have unintended consequences and create more barriers when these are urgent needs that have to be met on a timely basis, as you mentioned. So I don't know, from, like I said, maybe that's not helpful, but I think just want to say again, you know, removing as many barriers as we can, making sure people get these in a timely manner. I mean,
Oh no, I lost.
oh, I was saying it's already a dire situation these people are in, which I think that's a problem with the requirement, but that's for another day. But yeah, removing as many barriers as you can, because these people already experience barriers. And yeah.
Absolutely. Thank you, Carissa. Oh boy, I'm suddenly realizing that I could talk about this form for hours, but we have less than an hour left. And I know people had good feedback for things we have not gotten to. So I'm going to keep scrolling and keep welcoming hands, keep welcoming chat. And these have all been really great comments, questions, and requests. And this is the section where we start to look into the qualifying eligibility criteria for identifying those service needs. I want to pause here. And Pamela, I think you sent me a message directly. Can I say it out loud? Because I would like to. Okay, which is for member HRSN needs and qualifying eligibility criteria section. I think each need or eligibility type and set of corresponding questions should be separated out and have clearly labeled headers and a quick explanation on what they mean. This would help with organization and clarity and will give those who are willing to fill out the form by themselves adequate context as to why such specific questions are being asked. Thank you so much. And I do think something that I'm seeing in there is people are going to wonder why. Why are we asking this information? Carissa.
Yeah, I'm just curious if what's the criteria in terms of being eligible for services? Like if they just check one of those boxes on the left, is that enough or does it have to be multiple, more than one?
I'm going to phone a friend on this. Meg, do you have additional context into this section?
So in order to, I'm pausing because this benefit is incredibly complicated and it depends on what service you need. If you need rent or utility, you have to meet HUD definition. HUD definitions of houselessness are at imminent risk of losing housing. And in those circumstances, additional information is needed. And I think that one of the themes that I'm getting from all of your feedback is be very clear about what it will take to be eligible for one of these benefits and don't set people up for false hopes.
Yeah, because like that question, are you worried about losing housing? I don't think that's relevant whatsoever, given the actual criteria for being able to obtain these services. It's very misleading.
Point taken. Thank you.
Thank you. Oh, go ahead.
From the internal team is, does this make sense? Because you had the first checkbox within the past 12 months, have you ever stayed in a variety of places because you had nowhere else to stay? How does that land to you all? What kind of answers do you think you'd get to that?
Oops, sorry, I just came off mute, but I might as well just go with it. Yeah, also sounds like very irrelevant because unless they're currently experiencing, as far as I understand, it'd be nice if it was covered for those two first check boxes on the left, but it sounds like from what I understand, it's not. So it's definitely, again, giving false hope.
And I see some questions on definitions and clarifying definitions, such as, a certain time frame. What does imminent mean? And whether it might be easier to answer these as yes or no questions versus check boxes.
And just for information for this group to have, the other non-rent, non-utility services eventually will be made available to individuals who have a much broader definition of at risk of losing housing. But initially, when this benefit goes live, it will be for individuals who meet the HUD definition of at risk of losing housing, which is very imminent.
Can I just say, I don't understand, like there's people who, what if they were just temporarily in, like they were suffering from either houselessness, homelessness, or temporary housing, according to that HUD definition, but they were able to find an apartment and they're trying to sustain that and maintain it without losing it again and going back and being, churned in the system. Like, why is that not a priority?
That actually is the priority, is that given the limitations of this benefit, because it is only a maximum of 6 months, that it has been decided that the priority population are individuals who are currently housed but at risk of losing their housing. So your example, say somebody finally somehow got to get into their housing, paid some amount of rent, but then had a health crisis or something happened in their family, or or something happened with their job and they are now at risk of losing that housing, this is who this benefit will serve. At
Okay,
least-
so my question, and sorry,
Mhm.
I didn't mean to, I'm just wondering, like, because like, for example, with, and I know it's different funding, but like for flex funding, they require a eviction notice, which it's like, why would we want it to get to that point? That's not right. And also, then not only do they require eviction notice, it takes 6 weeks or longer to process. So again, it's these unintended consequences that we need to think about.
Thank you.
Thank you for airing that.
Meg, I have what might be a very silly question, and then I do see hands and I see good comments. My very silly question is, do we have capacity to make this form smart at all, where if people list what services they need, they only get the questions that relate to those, as opposed to the whole constellation of very personal questions?
Jessica, you know that you know much more about the ability of OHA to create smart forms than I do. I love you putting out that wish to the universe, and may we be able to meet it.
Because I see a lot of questions or comments that people are putting in, like, how do we really distill it down to what is truly needed to get people what they're asking for and what they need? And then my brain went to how smart can we be? And I don't know how smart we are. I can't promise we're smart on this timeline. But I'm putting it out in the universe. And I do also, sorry, I'm going rogue for a second. I think that there are very important questions on how we are defining the eligibility and the benefits that we cannot answer today. So I think that it's extra important to put them in the chat because of that. But I do want to say that out loud because I think that's a whole new conversation that I want to give the time and energy and for us to talk about where we're at and what's possible right now in implementation versus where we're building towards in the future. And I don't have those answers. I'm just going to say that out loud. Because this is where it's going to be very easy to get into some pretty complex and weedy conversations on exactly how these things are being determined on the back end. That is definitely part of the conversation we need to keep having. Sorry for that soapbox. Yoni, I see your hand is up.
Hey, thanks for taking my question. I wanted to follow up because what the person who previously spoke said really struck a chord with me around people that were unhoused that we've managed to house but are at risk for eviction now that they are off the streets. There are a lot of non-financial reasons that put people at risk for eviction, like an unmanaged, undiagnosed behavioral health issue or substance use disorder issue or physical health issues that lead to deterioration and decomposition of the body. And I guess what I was wondering is, are we creating a space here through the care management team to be able to link up case managers from a social service provider and health system care coordinators to address the health issues? Because I'm thinking a little bit down the line around folks that we, enroll in the HRSN benefit. Again, they're going to have health issues. They're going to have behavioral health issues, substance use disorder issues, and housing them alone with 6 months of rent assistance is not going to address those issues. So how do we ensure the real integration of all the systems we're creating?
Thank you, Yoni. And I'm really struggling, everyone, because these are all really good, but I also want to make sure that this eligibility and service need form is one small part of this larger constellation of what it's going to take to successfully connect people to the care they need, both within HRSN and across OHP and other services that are outside of OHP mechanisms. And I want to give space to that. And I also want to go through the form. And so I am struggling a little bit with where we focus today, while also wanting to be super open to these really important things for the ongoing conversation.
And maybe, Jessica, if I may, one of the things, Yoni, that your comment makes me think of is there's already been feedback that the boxes on the right of the desired services need to have greater specificity so people know what we mean when we say pre-tenancy and housing transition services, tenancy sustaining services. Tenancy sustaining services is exactly what you're talking about. What are do you need soundproofing in your house or in your apartment so you can scream and not get kicked out for it because it is who you are and what you do, for example, in some of the feedback that I've heard from other community members, for example, right? Or, you know, and how do we both specify that, but that perhaps what you also want is whether it's a checkbox list or just an open text box of what are the other things that I, as an individual, filling out this form, or my client needs to thrive, and how do we start making those connections and getting that information to CCOs and the care coordination team, recognizing that y'all are the ones that may have the trusted relationship with members and they're going to talk to you and not their CCO care coordinator. So how do we share that information in a way that doesn't require the member to tell their story over and over again and advocate over and over again to every system that they come in contact with? Does that kind of sort of, I don't know, maybe follow your dream a little bit? I know.
Thank you. That was very helpful. Yes.
Kimberly, I see your hand up.
Thank you. There is so much rich discussion right now, and I just started realizing, so we're doing this form. So HRSN providers are going to be providing, you know, like this form, doing it with individuals. But to clarify, and I want to make this really clear, that this is not a guarantee that an individual is going to receive services. Like this is like the CCOs have the ultimate decision whether it's going to be approved or not. And I really want to be mindful that HRSN service providers, those who are in community, engaging with individuals, like we're not creating like this mistrust when they're not approved or if things go sour. Do you get what I'm saying? So that was my thought, and it had nothing to do with my first question that I had, but yeah, I'll remember at some point.
Thank you. And I think that's part of the larger conversation as well, which is how are we all holding one another accountable to these members? I know that HRSN and HRS, oh, I'm so sorry about all the acronyms, health-related social needs services versus health-related services are going to act and have very different opportunities for, you know, how we are holding one another accountable, because there are stricter guidelines around this. And so absolutely. Sorry, all. There's so much good stuff here. I'm struggling with keeping up. Because go ahead.
It's Carissa. Yeah, again, sorry. Just something I'm wondering. I know like Meg put in the chat that the definition and requirement is based on HUD, and that's like a negotiation you guys had with CMS. I'm just wondering, with the Rules Advisory Committee, if that's something you can take back if something comes up that you know, something different would be better. You know, I've been to like housing equity trainings, and I've heard that, you know, even getting a letter of eviction can really look bad, even if they end up not getting evicted, or, you know, it can just be detrimental to someone. Like, and that's what I'm just thinking, if there's any way to prevent getting to that point, especially when you're dealing with people who have already dealt with having insecure housing, I think we need to not just brush it under the rug. I mean, clearly whoever was at the table to decide that with CMS does not have lived experience. So I'm kind of tired of people deciding on things that don't have lived experience. And so it'd be nice to make sure in the Rules Advisory Committee that people with lived experience are part of it. And if there's any way to take some of those things back to CMS.
Thank you, Carissa. And I'm realizing I should say out loud, there is a Rules Advisory Committee scheduled for October 18th. That is specific to the climate benefits, and you all are absolutely invited And I will make sure that you get that information in our follow-up, and that the other rulemaking processes are not as far along, but absolutely we can commit to being open and transparent with those opportunities. And thanks for bringing it up, because I got a little tunnel vision on this document, and I might not have said that out loud if you hadn't prompted me.
And Chris, I just want to say that while we are restricted to our negotiation with CMS, and so there are some things that we cannot change, I love your provocation, and it's, I think, getting every single OHA staff who's on this call thinking about, so what can we do to prevent an individual from getting that eviction letter? Or how can we get as upstream as possible, given the limits of this, given the limits of our current constraint? And you know, as Jessica said, we hope to make this benefit evergreen. And so how can we also collect the feedback on how this benefit is harming people, so that when we apply for renewal, we can make a better case of why we need to go further and further upstream, which is heart-wrenching and pretty despicable that we're willing to continue to harm people. And that may be one of the places where we are at. So I just want to thank you. Even if I don't have a great answer for how we can prevent an eviction notice, I am already thinking about it, and already thinking about some of the conversations with colleagues about what we can do within the constraints that we have. So I just encourage people to continue to push us. That's where we
Thank
want to
you.
get.
And yeah, I just wanted to say, I mean, there's groups out there who that's their entire focus. So I think leveraging what exists, that's really important too. Even just in Oregon, not to mention nationally, there's tenant councils and associations, or whatever they call themselves. But I think, yeah, thinking upstream, but also the downstream. Do you want that person to be able to renew their lease? Do you think they're going to be able to renew their lease if they had an eviction notice, even just one? Things like that. Like, if we really, what are we really trying to do here? That's what I'm, getting at. It's like, what is the goal? We're not just checking boxes. I get that, like OHA and CCOs and whoever else, they're checking boxes to get their paycheck and to do whatever and get funding. But these are people, their lives are in your hands. So stop checking boxes and actually do things that are going to help them long term.
Thank you, Carissa. I do want to call out, I see a question, will CCOs have specific criteria that can be seen so that applicants will know if they have a chance to receive the benefit, or is it at the discretion of the CCO? And I think that's a really big difference between HRSN and the health-related services, is that there are being built very specific criteria. I would love to, I think as soon as they are built, we can share them with you. Phoning Meg, my more policy-oriented friend on this, but absolutely there are going to be specific ways in which we are holding CCOs accountable in their contracts and in various other ways. Meg, did I speak right?
I got nothing to add, Jessica. Thank you.
And oh goodness, this is all very good. I am pulling back to the beginning of the session. People immediately commented on, we asked people's date of birth, so why are we asking these questions? So I just wanted to say that out loud. I saw that in the chat. Yeah, that makes good sense.
Brilliant. We shouldn't be. We shouldn't be.
And then I also just want to signal boost what I am seeing in the chat around, we need to make all of this simpler. We need to make all of our definitions clearer. And these are questions that people may or may not feel comfortable answering in a form on their own, or if they're in a setting that maybe they don't feel they understand what's happening with this information.
Brittany, thank you for your comment that substance use disorders should be added. We agree, and as the psychiatrist at OHA, you can imagine that I put that in the chat. So thanks for just underscoring what I also saw. Yes. One of the things that I want to raise with this is one of the criteria, knowing the barriers, the stigma, the harm that has been done by the behavioral health system. We have an allowance that individuals with an undiagnosed behavioral health condition may be eligible. How do we ask about an undiagnosed behavioral health condition? And what we're trying to do with that benefit is acknowledge individuals who are struggling, have impacts because of substance use disorders, because of maybe psychoses that haven't been diagnosed because an individual is actively using. Life experiences that have led to significant stress and the manifestations of that stress, but individuals haven't wanted to, haven't been able to, haven't found the right match in a behavioral health system. So how can we ask those questions to make space and welcome individuals who we know would likely qualify if they got services, but for all the reasons haven't yet, aren't able to. And that is particularly for mental health conditions and substance use disorders, the undiagnosed allowance.
Thank you.
Another one that we're struggling with is, do you have a functional limitation? This is really around activities of daily living, independent activities of daily living. How do we ask this in a way that is meaningful and is not full of jargon? We ask it a little bit in the second question, do you need assistance with activities such as getting dressed, eating, bathing?
Misha, I see your hand.
Yeah, when I was reading through this, I was thinking, you don't really need, do you have a functional limitation question? Unless you're going to really define it right there, or, you kind of need that one or the one below it, and just keep it really simple and not use the jargon. Do you need assistance with activities such as, and give a list of the ones. So yeah, I can just imagine immediately having to answer, what do they mean by a functional limitation, So just eliminate that one and just give the one that lists some examples. I think, yeah, keeping the questions really straightforward, limiting the jargon, keeping the language super simple, and the questions that, yeah, that quote unquote really matter in this context.
Thank you. I do, there's a question about the purpose of this section in regards to eligibility, and Meg, if you could speak a little more about that.
I can, and I was just typing that. So these are the clinical criteria and the social needs criteria that are part of the eligibility requirement. So in order to be eligible for an HRSN benefit, you have to be one of the covered populations, the transition populations. You need to have you need to meet a clinical criteria, and you need to have a social need. For example, you need to need the housing, or you need the tenancy sustaining services, or you need the climate related device. And so this is a way, and again, I think one of the goals of this forum, whether or not we're getting anywhere close to meeting it or not, is how do we reduce the chances that individuals will be asked the same questions that they've answered multiple times by multiple different entities. If you're a community-based organization, you know this individual well. How do you get that information to the CCO? So the CCO care coordination team doesn't need to ask that individual the same questions that are already known. So this is a way of being able to share some of those health needs that would allow eligibility into this program.
Thank you, Meg. Realizing that some of these questions look a lot like questions on the OHP application, some of which are required and some of which are those race, ethnicity, language, and disability questions that people may or may not have answered. And then I do see a call out, it's Domestic Violence Awareness Month. What about people who have experienced that? I see a question here on that, and I immediately think this is not always a safe question to be asking people.
Yeah, in regard to that, I mean, again, it might be helpful to maybe, especially OHA's position of having the credibility and relationships, existing relationships, you know, talking to the domestic violence groups that we have that exist in the state. And again, I think this just comes down to the fact that we're having, it's going to be, there's going to be a lot of unintended consequences. The fact that this is, like, we're already talking about people on OHP. Why is this just not available to everyone on OHP? It's not like everyone is going to be asking for this. So I think it's just creating barriers, trying to fit people in boxes and just check off boxes. And it's like, why not just make this a benefit available to people on OHP who need it because they're telling you they need it? And I just don't understand why we have to create this, as it's a huge barrier, and making it only specific populations. Like, obviously people have proved that they're low income if they're on OHP. So if they're saying they need help with rent, give them help with rent. If they're saying they need help with food, help them with food or whatever it is that they need. This could exacerbate disparities, and I think that's being missed.
Thank you, Carissa. And I don't have satisfactory answers. I know that there is an aspect of the waiver that has to be, is the phrase cost neutral? There are limitations in how much money we have, and we have directives from the federal government that we have to work within. But I think that that's something that is absolutely worth saying over and over again and reevaluating every step of the way.
Because honestly, I'm sorry, but I'm obviously very passionate about this.
Yeah.
But I think it's like the people who need it the most might not even have access to services as it is, or like to be able to go through to even get to this point of answering these questions. So I think that's the whole problem with not having people at the table who've experienced these things, because it's just perpetuating a system that does not work. And yeah, I mean, thinking about that.
Yeah. Thank you, Carissa. Realizing that I almost made it to the end of this, and I do want to, actually, that was the end of this. I want to pause. I want to especially welcome folks who have not said anything or raised their hand or put anything in chat, to just offer, if you want to reach out in other ways, we absolutely are open to that. I wanted to check, Meg, I know we're sharing this today. If people have additional thoughts, comments, suggested edits, can they continue to send them to us? Is there a timeline for that?
We are needing to get this form to the CCOs near immediately. You have until our CCO meeting Thursday. I will
2
also,
days.
yeah, I will also say humbly, I know we're not going to get this right. we so appreciate your thoughts. I've taken notes. I know many others have taken notes. And so we'll do what we can to incorporate everything. And if we don't get it right in this first form with climate related devices, then we'll have an opportunity to change it when we launch the housing, the rent and utility and housing related benefits in November. So while there is this urgent deadline for right now, know that there will be other opportunities, and we'll continue to seek them to get your feedback and to make changes.
Thank you. And goodness, we're already running out of time. I did see a question about how does foster home being adopted or in welfare or child welfare account relevant to needing or receiving these benefits. I do think part of some of these questions are we are seeking any information that we can use as inclusion criteria. These are not exclusion criteria. These are inclusion criteria. And so there are ways in which the, actually, if you'll give me one moment, we have our appendix, which includes the transition populations. And so you will see, I will not argue for how well or poorly we're doing, but these are questions we are seeking to ask around identifying people who fit into these categories to be included in consideration as folks who are specifically left behind in our systems and our services. And so they're being prioritized in agreement with the federal government. And so I did want to call out just one clear way in which this, you can maybe see our attempt to connect these dots. And I also, I guess I have to transition into like closing statements. I never feel like we have enough time. I also want to reiterate some of the things we said at the beginning, which is that filling this form out in its entirety is not required before we move forward. And I think if people hit one of these inclusion criteria for a service they are seeking, it actually makes me wonder if we need to collect more once we get to that baseline of people we know we are able to help. So I do want us to think not of this form as something that has to be exhaustively filled out in order for people to get help, but that it's trying to be inclusive of all the ways we can include people. And I'm sorry, I'm trying to get through this. I'm trying to talk while looking at a slide deck while looking at the chat. And it's not going great. Okay. There's a lot of great stuff in the chat. There's a lot of great stuff that has been said. And there's a lot of great stuff that relates to various other topics we have started to cover or still need to cover with you all. With that in mind, I wanted to share some updates on work that we're putting together right now to bring to you all in the near future. One thing is that we are alluding to the outreach and engagement services a lot, but we haven't had a conversation about what's included in that and really talked through what that might mean to folks who are either providing other health-related social needs services or acting as referrers to this. And so we want to talk more about that with you all and share what we know right now and get your feedback. And we also want to circle back to every single time we meet, people are asking about these community capacity building funds. We had an intro session, but I think it's time to return to it. So we have that scheduled for the beginning of November. So I did want to call that out as a little bit of a roadmap and also to invite you to let us know if we're on track with that. These are some things that we've identified that we're hoping to be ready to share in a meaningful way with you in the very near future. And I know by Thursday is not a great timeline, but I do want to point us to the inbox. This is the fastest way to get this information to us. When in doubt, I know you've been in communication with maybe a few different folks in the waiver. If you have any questions, please feel free to reach out to me as well. And we continue to have other ways to stay connected, including we have now an external newsletter that is live and regularly updating. We have monthly webinars that are more informational based versus this is trying to be a lot more interactive here. And I will also make sure that the information about the RAC, the Rule Advisory Committee, which was posted in the chat, but the chat's going really fast. So I'll make sure that that gets to you as well. Whew. And it's 2:54. I am happy to stick around. And I honestly haven't even caught up in chat because I was busy talking, but I think that you have given us a lot of really important feedback, asked really important questions. We have answered some of them. We have been furiously taking notes on the back end to see about the ways in which we can make this form and the whole host of other things that are going to go along with it better. And it really is an ongoing partnership. And I know this is one way of many ways that we're trying to be more available, but I hope you find this useful. If there are any ways we can improve these sessions, please don't hesitate. And thank you so much for being here. And we hope to see you in 2 weeks. And I know folks are probably leaving now, but I want to share what is a tiny win for me, which is we got to talk about this form with you before we talked about it with CCOs. They're getting something akin to this experience on Thursday, and we got this form to you, I think a week and a half ago, which is small. It's a small win, but it's a win that I consider pretty important too, is that we are working to get you the breaking news as it's here. And so I know the timelines are short and they're unsatisfactory, but we are prioritizing this venue and you all, and I will continue to do that. And you have some folks who are very committed here internally and externally, and I hope to continue to carve out more space here. Thank you all.